Good afternoon. I'm Pat Living with the Department of Health and Social Services and moderator for the COVID-19 update for Tuesday, June 30th. We are joined today by the Yukon Premier Sandy Silver and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. We also have with us André Boursier from the French Language Services Directorate, who will translate any questions from French-speaking journalists. Our sign language interpretation is being provided today by Kevin Klein via Zoom from Winnipeg. Our regular ASL interpreter, Mary Thiessen, is taking a very well-deserved break. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have one question plus one follow-up. Thank you. Premier Silver.
Thank you very much, Pat. Hello, everybody, and thank you for joining us here on the traditional territory of the Kwanlin-Dun First Nation and the Ta'an-Quachin Council. Today, I'm happy to provide an update of our government's response to COVID-19. As you know, 2.5 months ago, we introduced restrictions at our border to limit the entry of individuals. These restrictions have presented both social and economical challenges, but they were introduced to protect the health and safety of all Yukoners. As a government, we need to strike a balance between public health and individual rights, and we have done this in the least intrusive way all along the way. After a little over 6 weeks into Phase 1, tomorrow we will begin Phase 2 of our Path Forward plan for lifting COVID-19 restrictions. This marks a significant milestone following a great deal of progress over the last few months. It is possible thanks to the precautions taken by Yukoners over the course of the pandemic. So again, I want to thank everybody for your continued efforts. The past few months have given us all time to adjust to life in the era of COVID-19. We've learned as individuals, we've learned as communities, as businesses, and as organizations how to take precautions, how to operate in ways that protect ourselves from the spread of COVID-19. We are now in a position where we are able to lift border restrictions, and tomorrow, new border control measures will also come into effect. As of July 1st, residents of British Columbia and Yukon will be allowed to travel back and forth without the need to self-isolate for 14 days. Residents of Northwest Territories and Nunavut will also be allowed to enter Yukon without the need to self-isolate for 14 days, provided they traveled directly to the Yukon from one of the territories or through British Columbia. Additionally, residents from other Canadian provinces will be allowed to enter the territory under the condition that they self-isolate for 14 days in Whitehorse upon arrival. As we lift restrictions, we again need to strike a balance between protecting the health and safety of Yukoners and individuals' rights. We believe the new border control measures will allow us to do both of those things in the least intrusive ways. Travel to Yukon from outside of British Columbia and other territories is not recommended at this time, and all individuals coming in from other places in Canada will need to provide a plan for self-isolating in Whitehorse upon entering the territory. Enforcement officers will remain in place at the border to greet visitors and keep them informed about what is expected of them once they enter the territory. This includes American travelers who pass through our territory on their way to Alaska or south to the lower 48. Nearly all of our visitor information centers will also open tomorrow to keep travelers informed and help them safely and responsibly enjoy their time in our territory. Our goal as a government remains to contain the spread of COVID-19 in Yukon and to protect the health and safety of Yukoners. To achieve this goal, we are working closely with Dr. Hanley and his team. Dr. Hanley is providing advice and recommendations on how to address the COVID-19 pandemic based on the latest epidemiological information and in coordination with public health officers across the country. As Dr. Hanley will tell you and can tell you, the data that is emerging from across the country is promising. We are in a better position today than we thought we ever could have been even a few short weeks ago. We continue to monitor development elsewhere so that we can be responsive to the situation as it unfolds. Every week I touch base with my fellow premiers to ensure that we are aware of what is happening in each other's jurisdictions and can move forward in a coordinated manner, or at least as coordinated as possible. as we are in regular communications with First Nations governments and municipal leaders throughout the territory, and I want to thank their leadership for those continuing phone calls, Zoom meetings, and conversations. We are very fortunate to have no active cases of COVID-19 in the territory. This is a testament to the measures that we have put in place based upon advice from Dr. Hanley, as well as Yukoners who have done their part to follow the public health recommendations like the Safe 6. The fact that we have no active cases does not mean that we are in the clear. I must urge Yukoners to remain vigilant. We have all a role to play to keep our territory safe, and I cannot stress enough the importance of not getting complacent. As we begin to welcome visitors, we need to ensure we continue to practice the 6 steps to staying safe. These are 6 steps every Yukoner can take to help themselves and others to be safe. These rules apply whether you are going out camping for the weekend, shopping at local businesses, or visiting with friends at home or at the bar or at restaurants. Starting tomorrow, restaurants will no longer be limited to 50% capacity. Updated guidelines for restaurants have now been released to help restaurants understand how to increase capacity in a safe manner. Even though the capacity restrictions have been lifted, the Yukon Liquor Corporation will continue to offer licensees a discount of 25% off of retail price for liquor as a way to support restaurants through these times. The Liquor Corporation is also working with licensees to provide more flexibility around patio space and hours of operation. As of tomorrow, outdoor social gatherings of up to 50 people will also be allowed as long as individuals are practicing physical distancing. This is good news as Yukon looks to celebrate Canada Day. The pandemic has provided us all with a lot of time to reflect on our lives and our place in the world. We are extremely lucky and fortunate to live here in Canada, and the compassion, care, and community-mindedness of Canadians has really shined through over the last few months. We have a lot to be thankful for and a lot to celebrate as a nation. This includes our multiculturalism and diversity, which are great strengths in our country and also in our territory. Today is the last day of Pride Month. Yukon Pride has announced they are planning to hold the 2020 Yukon Pride Festival in early August. I know many Yukoners are eager to hear more details, and my colleagues and I are looking forward to joining in the Pride celebrations. We are proud to celebrate Yukon's vibrant LGBTQ2S+ community. There is also an opportunity to support all of the work that has taken place to foster a more inclusive, welcoming, and progressive Yukon. Again, even as restrictions are lifted, the Safe 6 remain very, very important. If we all follow these steps, we can greatly reduce our own risk and the risks to others. Thank you very much, Dr. Hanley.
Good afternoon, bon après-midi. Tomorrow, Canada Day, is another big day for Yukon. It marks the day that we will make a slow exit from our cocoon. Since the gates shut 3 months ago, we've been able to fend off outbreaks, and we've kept the number of cases to a bare minimum. We have kept our seniors and our vulnerable populations safe from COVID. We were able to take the time to learn about COVID, learn from others, and prepare our defenses. So tomorrow brings a new challenge for all of us to adapt to a new world where, for the time being, COVID is a fact of life that we need to learn to live with. Opening to BC is worrying for some. I am getting the emails to reconsider, just as I'm reading the ones that ask me why we're moving so slowly. To be completely honest, I'm nervous myself about the weeks ahead of us. As I've said before, this move is not without risk, but we need to be very clear that keeping the doors closed is also high risk and clearly not sustainable. The risks with the BC bubble are there, but they are small. In theory, the occasional person coming in with COVID should not cause much impact as long as we continue to prevent the damage from any one case. But the wrong case in the wrong setting could be like a spark in a dry forest on a hot Yukon summer's day, a wildfire which could take a long time and much effort to overcome. COVID's threat has by no means gone away, as we see every hour on the news, but we do know now how to keep it at bay. Regarding the change to our entry order as of tomorrow, I'm actually quite relieved that we will no longer have this prohibition. A blunt tool that we may have needed at the beginning to buy us time, but a tool that is indiscriminate and sometimes unkind. We can do better. The tool that we continue to wield for now is a finer one of self-isolation. Self-isolation that we will no longer impose on BC and Northern residents in return for their cooperation. And even the tool of self-isolation is an overwieldy one that in the weeks to come we can look forward to gently lifting as well. We can do better with less enforcement if we all move together. For now, we're very unlikely to see a rush of people coming to see Yukon. The general message is still to limit travel, and most Canadians are not straying far from home. Self-isolation is also not exactly an incentive to enter Yukon unless for work or other pressing reasons. For the next few weeks, while the BC and Northern bubble begins, people coming from other places will still be required to self-isolate for 14 days. Even those coming here to work will have to do their 2 weeks before getting into the workplace, unless required to get to work for critical reasons. When I think about what it's going to take for us to sail safely through the next few weeks, I think in 3 groups of 6s. The first group of 6 is the 6 areas we will be keeping a watch over. As we start to emerge back into the world, I and my public health response team at the Health Emergency Operations Centre will be watching what happens and making adjustments accordingly. The first of these 6 is community engagement. We know there are mixed feelings in the communities about opening up. As we progress, we'll be looking at what changes from the rural point of view. Are community concerns being addressed? What are we hearing about visitors? Are travelers being respectful? Is the increased visitation making a difference? Second is the preventive measures. How are we doing with gatherings? Are they being orderly? How are the social gatherings going? Observation of the safe 6. Much of this will be based on feedback that we're hearing. BC uses Google information to look at how people are respecting physical distancing. We cannot draw on this tool ourselves due to our low population, but we will also be drawing conclusions from BC data and elsewhere. Third, how is the healthcare system coping? Is there any strain on our healthcare resources? Are people going back to see their doctors and nurses and dentists and optometrists? And yet, are we conserving the capacity to quickly respond to COVID cases should we see a sudden demand? Fourth is public health capacity. If there are cases, how are they being managed? Is testing and tracing on these cases working? If there is increased demand on contact tracing, are we keeping up with the demand on resources as we anticipate? Do we have sufficient reserve to handle more? Fifth, we will be closely watching the COVID's course in the rest of Canada to determine the risk of importation into Yukon. We'll continue to closely monitor BC to see if they are maintaining stability with their cases while seeing how the other provinces are faring. If there are upticks in cases, are the cases being driven by outbreaks or by community spread? If cases are rising, how is the risk to Yukon affected? And lastly, of this first group of 6, is the virus still contained? Can we stay ahead of community spread and promptly respond to and contain outbreaks? The second group of 6 is a call to remember our 2 groups of 3s. The first, 3 C's to avoid. The second, 3 T's to espouse. Remember once more those 3 places or encounters to avoid: closed spaces, crowded places, close contact settings. Close encounters of the COVID kind, you might say. On the plus side, we're aiming for the 3 T's: testing, tracing, and trust. Our part is ensuring that our testing capacity continues to be robust. We will have new testing criteria ready by mid-July. In anticipation of the demand for increased testing as our border opens up, we will reopen the Respiratory Assessment Centre in another location on July 6th. There will be more details to follow, but we feel it's important to have this alternate testing facility up and running as we expand testing criteria and look well ahead to flu season. Similarly, we're working on our capacity to contact trace. And as we work through this next stage, I hope that we can continue to build trust in this overall approach, a trust that depends to such a critical degree on everyone doing their part. And the third set of 6, of course, is our best known set, the reminder once more that doing your part means observing the Safe 6 today, tomorrow, and through the months to come. No doubt we will continue to tweak and refine and reinforce the messages, but they will remain our critical defense. They will keep COVID to a tolerable minimum if we do them well. Wash your hands, use sanitizer if soap and water are not available, remain 2 meters away from folks who are not in your family or in your bubble, stay home if sick. Don't gather in groups of more than 10 indoors, and as of tomorrow, 50 outdoors. Be respectful of community wishes when you travel, and self-isolate when you're required to. Don't cheat on the Safe 6. It is easy to forget to wash your hands for 20 seconds or to wash your hands just because enough time has passed. Perhaps you've touched something and left your germs behind, a door handle, the arm of a chair, the keypad at the store. Hand washing is vitally important, as is maintaining physical distancing. A quick story. Last week I came home one evening to the doors and windows wide open in my house. It turned out that someone in the family, who will remain unnamed, had accidentally discharged bear spray in the house. My throat burned and I started coughing as soon as I entered the house. Over the next couple of days, I would do something as simple as touching the wall or grabbing the leash of a dog, reaching for the tap. First my fingers and then my hands would burn. In turn, quickly my face or my eyes would react as soon as I touched them. The fine pepper had settled everywhere, and only with thorough cleaning and washing did we get rid of the irritant. What a reminder of how an invisible virus can be present and be so easily picked up and carried, and then invade. If COVID were bear spray, we would surely be more protected as we washed away our pain. As we've moved further and further from our last diagnosed case here in Yukon, it's clear that some people are not maintaining the 2-meter distance between themselves and others outside their bubble. We need to keep that distance between us when outside of our bubbles. And for what I hear, some of those bubbles are being stretched to bursting all around us. Again, and in spite of the recommendation to double bubble with one other family or group of people, individuals are creating their own larger and bigger bubbles. Gatherings are growing beyond 10, and people are letting down their guard. Until vaccine or reliable treatments arrive, the world as we know it will be different going forward. Living with COVID is a project that could last a year, or 2, or even more. We have to live our lives, but we have to live them differently. That's all for my update. Thank you. Merci. Merci.
Thank you very much, Premier Silver. Dr. Hanley, we'll go now to the phone lines, and we'll begin with John from CKRW.
Hi. There was no mention of opening Yukon's borders to the rest of Canada in previous updates. I was wondering if maybe we could clarify where that decision came from.
Yeah, for sure. From a health perspective, things are looking good. The epidemiology data from across the country is promising, and we're in a much better position now than we thought we would be just a few weeks ago. Now, the government is still continuing to monitor developments in other parts of the country. We're learning from other jurisdictions as we go. We've seen bubble announcements in the other territories and in Atlantic Canada, and our approach is consistent with their approach. I'm in constant communication with the fellow premiers, as I mentioned in the opening comments, and watching what they're doing and watching what the nation's doing in a coordinated fashion is something that the First Minister's meetings has been talking about. We remain flexible and responsive to the situation, which is changing daily, but we are confident that we are in a good position now to lift our border restrictions tomorrow. We've had several weeks to prepare and to provide guidance to individuals and businesses on all the other directions to date. We do have a number of tools that we can use to manage this disease. We're looking at the 6 triggers that is in our plan forward, and based upon the epidemiology, we feel confident in lifting that restriction. Now, again, this is at the time we're still recommending that no travel from those other areas. But if people have to travel, they'll be required to do the 14-day isolation in Whitehorse.
Thank you. Follow-up, John?
No, don't have a follow-up question. Thank you.
Thank you. We'll move to Gabrielle, Whitehorse Star.
Hi. Is there any way to enforce the self-isolation rule for visitors from other jurisdictions? Do SEMA rules apply to them?
The fines and jail terms would not and have not affected the 14 days. We're watching anecdotal information from across the country as well as far as how well this has worked Canada-wide, because this is a requirement in other jurisdictions as well. So again, whether it be our guidelines to restaurants and bars, our social distancing measures, our border measures, working with the communities, what we've been doing to date is working. And if we find ourselves in a situation where moving forward causes any one of those triggers, those 6 triggers, clusters of cases, those types of things, we are well suited to move backwards. Now, every time we move to another phase or release some of the restrictions, we're very cognizant that we don't want to move forward if there's a huge risk of having to move backwards. So we believe that having people, having the requirement to do that 14-day isolation is enough at this time, and we will of course monitor the situation as we move forward. Folks need to remember that to date over 17,000 travelers have entered into Yukon since the border control measures have happened. To say that we're now closed up to the rest of the country is not necessarily so. We've had a lot of people doing the self-isolating already, and it seems to be working because the evidence has shown already that Yukoners have been self-isolating due to travel and due to entrance into the Yukon, also critical and essential service providers, and we haven't had a new case in months.
Thank you. Follow-up question, Gabrielle?
Will a place to isolate still be provided at the Coast High Country? And are people visiting from other jurisdictions eligible to request a place to stay there through the Yukon government?
So the new provisions for the rest of Canada to come and be able to self-isolate, again, we're not recommending travel from other jurisdictions in Canada now, but if they do come and if they have to, and they will have to self-isolate, they will have to come up with their own plan to do so. The provisions that we have currently are for the essential and critical workers, and so we don't at this time plan on having provided space for individuals that are coming. They'll have to make those arrangements on their own at this point.
Thank you. We'll move now to Stephanie, Yukon News.
Hi. I'm wondering, given the increased cases we're seeing down in the States, if there was any thought given to changing the restrictions in terms of people coming through to Alaska or going down south?
Good question. So again, out of those 17,000 travelers that have entered into Yukon since April the 2nd, approximately half of those travelers are on their way to Alaska. So we have thousands of people that have been traveling through Yukon since April the 2nd into Alaska. And again, we haven't seen a new case in months. If things change, then of course we'll have to address it. These are the questions and concerns that have come up in our calls, even this morning as I spoke to some of the chiefs today about making sure that we can continue to be vigilant when it comes to the travel into Alaska, how we can continue to, on a daily basis, on a weekly basis, hone our skills in tracking. There's a conversation on a federal basis right now. The federal government's working with Apple and Google to come up with some solution for an app that will help us to trace folks. The good news about being in a small jurisdiction like Yukon, we also have the ability to work with our community partners and community governments and make sure that we have the communications in place to monitor people as they transfer through our territory, but also as we look to the new normal and moving into our phases, that we have those conduits of communication to help make sure that we continue to put measures in place that reduce the curve, that plank the curve, but also include the communications with our communities to make sure that that anecdotal, on-the-ground information from all of our rural communities is being monitored and worked with this territorial government.
Follow-up question, Stephanie?
I'm wondering if there's been any figures run on how many people might be coming in once the restrictions are lifted tomorrow.
Yeah, I'll let Dr. Hanley talk a bit about, the last 2 weeks he's mentioned, the increase to risk of British Columbia. I would just add before turning it off to Brendan Hanley, because from other jurisdictions, we're following into the language. If you look at the plans right across Canada and other jurisdictions, it'll be pretty much the same wording of not recommended to travel right now, but if you do, 14 days isolation. That's a constant narrative right across Canada. We're not going to be promoting tourism in those regions at this point. It's not, we don't see it as being a lot more people coming up with these considerations. We're looking and monitoring the situation from Northwest Territories as well. Not a huge increase in traffic there. And again, when you take a look at the thousands of vehicles that are coming up to provide us our groceries, our supplies, those types of things, and into Alaska, we already have a lot of traffic that we've been monitoring and we've been keeping safe in these times. We don't see a lot more traffic because of the provision for the rest of Canada.
Yeah, I don't know if I have much to add. I agree with the Premier. Of course, what we're looking at is what would the anticipated increase be from the rest of Canada given the lifting of the entry order. And I think for all the reasons that we've stated, that's not likely to be a large number that would significantly change the current flow. The other question is what about the BC bubble and more? And I think there are going to be obviously two directions. One is Yukoners going to BC and then coming back, plus any visitors coming in from BC. So we don't know. We know there are increased bookings, for instance, on Air North, as the CEO has said. So that's clearly something we'll be monitoring with a lot of interest.
Thank you.
And sorry, I just want to clarify from a previous comment, not to confuse things. Self-isolation is enforceable through SEMA rules. Social distancing is not enforcing, just to reiterate.
Thank you. We'll move now to Chris, CBC.
Thanks. Question for the Premier. Last week, during one of these, you said that border restrictions would be lifted on travelers from outside of BC and the territories on July 15th. Now we're hearing that those changes are effective as of tomorrow. What changed between last week and this week?
So again, it's from a health perspective, things are looking really good. Again, monitoring the language on bubbles in Atlantic Canada and what their provisions are, what Northwest Territories is doing, and then taking a look at all of those conversations in the last week and working with Dr. Hanley's office, we came to the realization that we can do this now. What we've always said from the onset of this is there's going to be a lot of moving targets. We're going to see certain provisions maybe be pushed out. We're going to see other provisions being moved forward. We saw something similar with the opening of bars. And what we want to do is make sure as we get the information, we're getting it out as quickly as we possibly can. So, in 7 days since our last announcement, there hasn't been a lot of downtime, that's for sure. We've been working right through the weekend and through the week to make sure that we can move into this restart with the most up-to-date information. So we believe, based upon what other jurisdictions are doing, the call from the federal government to try to work on consistent language and consistent movement, everything down from smaller things like signage in stores was one part of the conversation months ago, to how we get into the restart and try to coordinate as much as we possibly can with other jurisdiction, looking at the anecdotal information from those other jurisdictions, and then turning to the public health officials for the recommendations and to check to see if the epidemiology would change. That's how we came to this decision.
Follow-up, Chris?
Well, you're also facing a court challenge for the government's border restrictions. Would you be making this decision to allow visitors from the rest of Canada into the territory if you weren't facing that court challenge?
They're two unrelated situations, of course, the petition being for something different. But I will say, Chris, that every decision that we do make takes into account the Charter of Rights and Freedoms. So absolutely, whether it's COVID or not COVID. And we will continue to consider the Charter as we move forward. Of course, we're bound by the Charter in all of our actions. And we have a duty to protect the health and safety of Yukoners here with the COVID pandemic. And we take this duty extremely seriously. So as a government, we need to take into consideration both the individual rights and also public safety, as I said in my notes and my preamble today. And we have done this all along the way, and we'll continue to do this all along the way in the least intrusive way.
Thank you. We'll move now to Anna, CBC North.
Hi, thank you for having me. So I just have a clarification about some of the border changes that are going to be taking place. So what happens to those that are traveling by plane from the NWT or Nunavut to the Yukon and have to pass through airports in other provinces en route to Whitehorse? So let's say there's no direct flight to Vancouver from Yellowknife, for example. How would people get to the Yukon? What happens to them?
Yeah, and thanks for the question. I know you weren't on our conference last week, but this question was addressed at that time too. We know that there's not direct flights right now from Nunavut, and you'd have to charter from those areas. But if you have to go to a jurisdiction that isn't BC, isn't Northwest Territories, and isn't Nunavut, then you would be required to self-isolate for 14 days upon arriving in the Yukon.
Thank you. Follow-up question, Anna?
So then with those border restrictions in place, what northern residents are these border loosening measures really for?
Sorry, you kind of broke up there. Can you repeat that question again? Sorry.
Sure. So I said the fact that, if people with no direct flights want to come to the Yukon and they have to self-isolate when they arrive, I guess what northern residents would be benefiting really from this bubble with the Yukon?
Well, Fort McPherson, for one. We do have a highway that goes directly into Northwest Territories. So again, we're making our decisions not necessarily just upon geography or ease of getting here, but also epidemiology. And at this time, knowing that Northwest Territories and Nunavut are entering into their own bubble, working with my fantastic partners in Premier Cochrane and Premier Segaviktuk, we are opening ourselves as well as we open up, knowing full well that it's pretty hard for someone to come directly from Nunavut into Yukon, but it's still possible. You could charter from a Nunavut, from some smaller communities into the centers, that type of thing, and you'd be allowed to if you found your way in. But again, if you have to go down to one of our provinces that still requires a 14-day isolation, then you as well would as well. It would be very similar to if you were in British Columbia and you were driving up, but decided to go over to Alberta, then you are now in a situation where you're coming from a place that requires a self-isolation as well. So I ask anybody who's traveling to contact yukon.ca and to make sure that they've either emailed their questions in or the phone line that are there to ask about their particular travel requirements and quantify right off the bat before you leave your community whether you're able to come directly in or if you have to self-isolate.
Thank you. We'll move now to Claudiane, Radio-Canada.
En français, parler un peu de ce qui est différent aujourd'hui, donc de l'abandon, de permettre donc des voyages, même ceux qui sont non essentiels, on réouvre la frontière essentiellement.
So the question is for Dr. Hanley, I guess. Can you please explain in French what has changed today and what are the travels that are going to be permitted even if they're not essential?
Oui, merci. Donc, à partir de demain, au-delà de l'accord entre Colombie-Britannique et Yukon pour enlever le besoin de faire la quarantaine en entrant. Il y a aussi l'enlèvement de la première ordonnance qui est ceux qui disent que le voyage non essentiel n'ont pas permis pour les autres résidents du Canada dehors les résidents de Colombie-Britannique et le Nord. Mais ces individuels-là, maintenant, malgré qu'ils sont permis d'entrer, on a toujours dans un état de décourager le voyage en général au Canada. Et aussi, on a toujours le mandat pour faire la quarantaine, les 14 jours de quarantaine pour ces individuels qui s'ils ne sont pas de Yukon en rentrant de Colombie-Britannique ou s'ils ne sont pas des résidents du Nord, des autres territoires ou de Colombie-Britannique.
Avez-vous une autre question, Claudiane?
Oui, donc pour les gens qui viendront nous visiter de Colombie-Britannique ou d'ailleurs, est-ce que quelles sont les règles pour aller dans les collectivités rurales, dans les villages? Est-ce que les gens sont bienvenus d'aller dans les villages?
So for those who will come to visit us, are they welcome in communities? What are the restrictions? Can they go anywhere?
Oui, donc ils sont demandés, les personnes qui viennent de Colombie-Britannique sont demandées de respecter les règles en place pour les Yukonais. Donc, au même temps qu'on ouvre graduellement la permission essentiellement de voyager aux communautés rurales, les Colombies-Britanniques sont inclus dans cette boule. Donc, on est permis, mais c'est toujours avec le cadre de respecter les besoins et ce qu'ils veulent les communautés. Donc c'est juste pour être prudent et pour limiter le voyage, pour respecter ce qu'ils disent les communautés. Donc ça dépend des communautés. Par exemple, la communauté de Dawson City, on ouvre sont annoncés qu'ils sont ouverts aux visiteurs. Donc, on peut conclure que les résidents de Colombie-Britannique sont dans la même famille. Donc c'est une question de respecter ce que disent les communautés.
Thank you very much. Thank you, Premier Silver. Thank you, Dr. Hanley. Thank you, everyone, for your time today. A reminder that our next COVID-19 update will be Wednesday, July 8th at 2 p.m.